Okay, so we might get started. First of all, thanks everyone for jumping on the call tonight. The fact that you've taken time out of your busy schedules to do so means a lot to us because this is a topic that we think is super important. We've got a lot to get through, so we'll jump in with some introductions. I do know a lot of you, but for those who haven't yet had the pleasure of meeting, my name is Sam, and I've been a physio in Tokyo for about 20 years and the last 30 of those as co-founder and co-owner of Club 360. My athletic background is in martial arts. I competed for a couple of decades at an international level in karate, and have since dabbled in Brazilian jiu-jitsu and boxing and kickboxing. And I'm also a father of three raucous little boys, aged 10, 8 today. Happy birthday, Alex, and 4 who are involved in both combat sports and field team sports.
So I'm Joe. It's nice to meet everyone. I don't think I've had the pleasure of meeting most of you yet. I'm still relatively new to Tokyo, only landed about 2 months ago. So my experience is I'm also a physiotherapist, and this is my seventh year to sing, and 5 of those have been in elite sport. I initially started my career out in Melbourne City Football Club in soccer in Australia, and then I moved to Singapore, working at the High Performance Sports Institute, as it's known now, which gave me a lot of opportunities to work predominantly with their youth athletes. In terms of my athletic background, I grew up playing lots of different sports, including AFL, mainly soccer, dabbled in a little bit of martial arts too, but didn't really get to the heights that Sam did. And then now I'm a competitive power lifter.
So, just a few housekeeping things. We're playing around with a little bit of new equipment here, and at the moment we're sort of all gear and deer. So, if there are any issues sound wise, just drop it in the comments, and we might just take the microphones out and speak normally. Also, be watching the chat section. So, if you do have any questions, you can pop them in the chat. If you have any questions that sort of pertain exactly to what we're talking about at a particular topic in time, you can just sort of pop on your mic and either raise your hand or just yell at us, and we can include that in. And I guess obviously not practical for us to go through an introduction for everyone that's on the call, but perhaps if you can just pop in the chat your sort of role within youth sport, whether you're a parent, coach, or athlete, and also what sports you're involved in. I know just looking at the names here, there's some people in cricket, there's people in football, soccer. We've got some of our winter sports physio colleagues here. So perhaps to get an idea, and we can maybe tailor some of the content to specific sports as well. If you can just sort of pop that in the chat when you get a second. Otherwise, questions, we'll have time at the end when we did our dry run. This took exactly 48 minutes, which is exactly how long I told Joe it would take, despite him not having confidence in me not being able to waffle along. But we will have some time for Q&A afterwards, so just drop your questions in there. So, to get started, why are we here? Actually, before we just the topics we're going to go today, just to give you a bit of a rundown. I'm going to talk about common injuries we see in youth sport and why those are a bit different to what we see in adults. We'll talk about load management, which is the crux of what we do in terms of injury prevention and rehab. We'll talk about supplementary resistance training. Um, we'll talk about diet and sleep, some of the psychological or psychosocial aspects of injury, and then also the basics of rehabilitation. So I think everyone here understands the benefits of sport for kids in terms of physical benefits, psychological, social, and emotional as well. And so when there's a gap in sport as a result of an injury, even if it's just a couple of weeks for a more minor injury, it really interrupts all those different sort of facets of a kid's life that are influenced by sport. If this starts to happen more regularly, then it can affect a child's, eagerness and enjoyment of sport and their willingness to participate in sport. as well as us understanding the benefits of sport for kids, we also understand the importance of physical activity and leading a physically active life as we move into adulthood. And if we start to form a bit of a disconnect with sport young, we're less likely to maintain this physical activity as we go into adulthood. And especially in the cases of more serious injuries, those perhaps requiring surgery or lengthy times away from sport, then we can see kids sort of drift away from sport altogether. And also when it comes to more of those major injuries, it can have a big physiological toll on us when we're older. So in the case of something like an ACL, which is the most commonly used example, if we suffer an ACL rupture when a kid, or even in early adulthood, that's likely to lead to early onset of arthritis, and that's likely to to change the way that we're active as adults. So it has implications, and so it's important that we do what we can to try to prevent injuries occurring. We've titled the webinar "In Prevention," but we can't really prevent injuries. Injuries are a natural part of sport, and at the highest level, if you're talking in team sports, if you have a team and you're competing at an elite level and no one's getting injured, probably not pushing as hard as you need to be. So injuries are not preventable, but there's a lot of strategies that we employ to decrease the likelihood of injuries. There's things that we can do to decrease unnecessary injuries. And when injuries do occur, it's important that we manage them well to restore that athlete back to sport safely and quickly, and decrease the impact of that injury on that person's life. So Joe's going to go on now and talk about some common areas of we see in kids.
Yeah. So I just wanted to highlight a few different categories of how we can classify common injuries, especially in youths and adolescents. So what I've listed here is number one, growth-related injuries, and then overuse injuries, fractures, concussions, and also we'll touch on complex regional pain syndrome as well. So I think the most important thing to highlight that, especially in growing kids or kids who are just about to finish their growth spurts or just starting to settle into their body, most injuries happen in the periods of their most rapid growth. It's also really important to note that it's unlikely that youths or adolescents will suffer from muscle tears unless they're kind of at that settled developed stage. Instead, they're more likely to suffer from the growth-related or overuse kind of injuries. It's also nice to know that, or important to note, that they can happen both via contact or non-contact. Um, they are the common injuries include a lot of high-risk injuries, including the bony stress to the lumbar spine, traction fasciitis instead of tendon-based injuries. So this can be classified more into the growth and overuse injuries. And in worst case scenarios, they can lead to more avulsion fractures, which we'll touch on and define. And these happen instead of the muscle strains that adults would generally suffer. Again, complex regional pain syndrome, where pain is kind of a lot more experienced than what we'd typically expect. And this can lead to more complications or delayed kind of rehab or return to sport as well. All right. So in terms of load management, I think the most important key factors here to consider is load and capacity and the relationship that these factors have. So load can be defined as how much like input or activity we're doing, and then capacity is how much can our body actually tolerate. So I always like to think of it as like a little string or little bar graphs. Like if this is your capacity and this is the load you're putting on your body, then you can kind of tolerate that because the load doesn't exceed the capacity. But once you kind of exceed that, that's where you're starting to get into the line or start playing with fire a little bit and put someone at risk of an injury. Um, so load can refer to things like volume, intensity, and frequency. So how often someone is participating in activity, how intense it is. For example, if they're doing lots of sprints or really high levels of activity compared to something that's a lot more chill and relaxed. And also how often they're doing these activities as well, whether that is both the high intensity or low intensity activities. So it's important to then note, especially with youth and adolescents, especially because they're in school, Load can also be cumulative, so they might be experiencing all these different loads in their sports if they're playing sports outside of school, in their PE classes as well, and if they're even going to the gym training outside of school and their sports. Um, it's also key that there is two different kind of periods of load, an in-season versus an off-season amount of load and capacity, and kind of how you manage load in those different time periods is also very important. And then the effect of holidays that has on load and load management as well.
So I'm just going to share. Oh, I'm stuck. Why can't I get into Chrome? Sorry, guys. Okay, so that has changed the sheet there. So what we've got here, I am a bit of a spreadsheet nerd. I like to work with numbers in every sort of facet of my life. What we've got here is a Google Sheets graph that's basically a very crude load management tool. Now, if anyone is interested, you can email me and I can sort of send you this or even sort of put together something that's a little bit more specific for your needs. But basically, what we're doing here is we're just using two separate metrics, the number of minutes of activity, either training or playing time, and then the intensity, which is a perceived rate of exertion, and basically just the athlete's interpretation of how hard that session, that game was. Now, this can be done as an individual, or if you're a coach managing teams, then you can come up with these metrics. Obviously, the time played is fairly straightforward. Obviously, in game, you might have players playing more time than others. But if you just wanted to get an overall sort of rough score of how hard your athletes, you can just use these two metrics. So, for example, let's say just week one, we're doing three 60-minute sessions and we're rating that as a 6 out of 10. Okay? And then we can here look at what would that equate to in terms of a cumulative load for the week. Now, this here is what we call an arbitrary unit of load, and that's what has been used in the research. It doesn't mean anything particular. It's just what we're using to compare one load, the load in one session to another, and then in one week to the next, and so on and so forth. Let's say we're using these metrics. We go into the next week, and maybe we go a little bit longer with some sessions, and maybe a little bit harder one of the sessions, but sort of keep it relatively consistent. Come over here, and just by putting in some other formulas, you can see how the volume or the load, as your product of volume and intensity, differs between the 2 weeks. And then let's say, the next week we went a lot harder in one of the sessions, so really pushed cells here. This one was a little bit more constant, and then maybe a little bit harder here. And then maybe we had a game on the Sunday, and so maybe 60-minute game that was quite intense. And then we get this figure here as a unit of load. So now, if we go back to the weekly graph, we can see here that week 3, was almost double the load as week 2. Now, we used to use what we call the acute chronic workload ratio. Probably about 10 years ago, this was very popular. This was done predominantly in professional week, but they found that by taking the average of 4 weeks of training load and then it compared it to the current week's load, if we exceeded the sort of average of the last 4 weeks by about 35 to 40%, then that was at a high risk of injury. Since then, it's come out that that metric as a specific number isn't that valid. But I think just applying some common sense, how you're increasing your load can be really useful. So just using this as a rough monitoring guide and seeing that, if you've doubled your training load in 1 week, then you may want to look at modifying the load in the next week to try and, I guess, rebalance that. What they found with this sort of acute versus chronic workload ratio injury risk is that it's not like the actual week where you're peaking your loads, where you're at highest risk of injury. It's actually sort of 3 to 4 weeks after that peak where the injuries come on. So I think this is just one example of how you might want to monitor load. But even if you just want to sort of take a paper and pencil, essentially what you measure you can manage. And if you've got an idea of what training load you're as a parent or a coach, what kids are doing, then that gives you a little bit more power to sort of potentially modify it, or at the very least, if the training load itself isn't modifiable, if you know that you have weeks of higher training, then just try and optimize everything else like sleep and nutrition, which we'll talk about in a minute, to try to balance that. Um, so that's one sort of load management strategy that we can use. Joe alluded to the relevance of holiday timing, and this is something that we deal with a lot here. I think in the environment that we're in with the international schools, often these kids are having massive breaks over the summer. Now, I teach the kids karate class at the ASIJ Early Learning Centre, and I'm only teaching these kids sort of once a week, and they're 5. They're not getting overseas injuries, or they probably shouldn't be. Otherwise, I'm doing something very wrong. But I know that for that particular school, the after school activities are kind of coordinated together. And I know that my classes finish up sort of in late May, early June, and often don't get started until sort of mid to late September. And so these kids can sometimes have, 3.5 months of essentially deconditioning. So they lose some of their capacity, and then they're often thrown back into quite a heavy training schedule when September rolls around. And that's, again, when we see these injuries start to pop up, late October, when the body has been loaded and not really in a state where it's not really ready for it. Now, this can be difficult to deal with, but I think as a coach parent, trying to instigate some type of running program, usually with this sort of stuff, it's lower limb. So trying to have some type of running and ideally some sprinting type program for the kids to follow over the summer. Now, I know a lot of kids, or some kids, do some summer sports programs or go off to sort of camps over the summer, which is great, but not everyone will be doing that. So at the very least, having some type of running and sprinting program, and that might involve jumping and some component of lifting, depending on the sport that you're involved in. And the uh, actually the idea of implementing that is pretty straightforward, but the practicalities are where it gets more difficult. So trying to have some type of either a spreadsheet like we demonstrated here, or WhatsApp groups, or even having, if the kids have close friends within the same team, trying to get them to work together to keep on top of each other, and holding each other accountable. And if you know that you have a group of kids playing in a sport in September, getting ahead of that before the summer and saying, if you want to be a part of the team, we want to achieve certain things as a team. And as a result of that, we're going to need to train at a certain intensity when you get back, and you need to be ready. So I think, thinking ahead of that summer break is really important. And for the kids that are going to be thrown into a heavy training load in September, just trying to do what we can to get them ready. Um, I think from a coaching perspective, also, if you can just think about maybe having a bit of an on-ramp type of program at the start of the season, though, that over the first 2 to 3 weeks, you're ramping things up a little bit slower, and not throwing too much volume at the kids straight away. This is probably, I guess, a bit of a topic, and even more difficult to navigate. But from a school sort of advocacy perspective, if you do have any power as a parent or a coach, trying to get it so that the kids do play sport for as long as possible before the summer break starts, and then trying to start the after school activities and sports teams as soon as possible once the kids get back. So I think within the population that we deal with, they're sort of the main load strategies or load management strategies that we tend to employ.
Yep. So I wanted to just have a couple case studies that we'll talk through. So the first one is apophysitis. So just to elaborate on this, a lot of you may have heard of or come across Osgood-Schlatter's disease. Um, I don't really like the name disease. I don't think it's a disease, but it's
Hate it.
yeah, it's more of a condition where, so to touch on before, like injuries happen when kids go through their most rapid periods of growth. So this kind of condition, similar to severs, which happens at the heel, Osgood's happens more at like the front of the knee. So when kids are going through this massive growth spurt, their bones will grow faster than their muscles. When this happens, if they're asked to then put a lot of force and perform all these activities and sports, the demand on the muscles is much greater. And because of that, now, like, if you think about it I mean, like in Australia, I was like a snake or a lolly. Be like a lolly, and then like that's the length of your muscle. Now that you've grown, that lolly then stretches out, right? But it's still the same muscle. And when you stretch out a lolly, it kind of becomes a bit thinner, it's a bit more clear, you can see through it, but it's the same kind of muscle. So in a way, you can think about it as it's a bit weaker at that point in time. But now you're asking it to continually contract. When that happens, instead of having a muscle tear like it would potentially happen in adults, it tends to pull on the site of where the muscle attaches. And in the case of Osgood Schlatter's, we're talking about the quads at the front of the thigh. And that attachment site is right at like the growth area or the growth plate of the front of the shin. So this is where people tend to get a lot of pain, and there might even be a little lump that develops there. Like if a lot of the audience who are here today, if you guys were very active when you were young, you might even have this lump yourself. Um, so in worst case scenarios, if we don't manage these conditions correctly, they can lead to these avulsion fractures, which I touched on before, where parts of the bone ends up chipping off because of the increased demand of these muscles in activity. So how does this relate to load management? So Sam, if you just go to the next slide for me. So in this sort of case study, I'm going to use an example of a 14-year-old male soccer player. Let's say he's recently started pre-season 2 weeks ago after going on holiday, and his previous season ended 6 weeks ago. So assuming in the past 6 weeks he hasn't really done much, maybe he's done a little bit in the like once the season finished, and then he's gone on holiday potentially overseas, probably just relaxed, chilled, swim, doesn't really do too much, and he's come back into training, and then. Um, Started complaining of right knee pain at the front of the shin, which started a week ago. So this is kind of in terms of like the story, this is kind of the typical case of something that could potentially be Osgood Schlatters. And then we'll talk about how this can manage from a load management perspective. So, some interventions, like in terms of soccer, immediately what we'd think about is if we refer back to Sam's spreadsheet, assuming we've got data from those 2 weeks, you'd expect there to be a fair spike in those numbers. So what we want to do then is to then kind of mitigate that. We want to remove this person from the games to then decrease the load back, because obviously now the load has exceeded his capacity. We then start a rehabilitation program focused on reducing his pain, and this might involve improving muscle strength and flexibility. And then instead of getting him to do nothing, we want to still increase his capacity because obviously the load exceeded capacity. What happens there is he drops. So what we want to do is give him enough load to then start ramping up and building up capacity again. So eventually he can gradually return to training and games based on his ability at that point in time. So this is where we'll touch on in the next topic, where we can focus more on gym-based training for the time being, reducing his pain, improving movement patterns, eventually touching onto technical skills, return to running, and then gradual return to training and games. Yeah. So in terms of the supplementary resistance training. So these movements here, the squat, the hinge, a split or single leg, an upper body push, upper body pull, core, jumping, landing mechanics, I think they're more fundamental kind of movement patterns that every person should and every athlete be performing. So again, when adolescents or youths are going through these periods of growth, we tend to find and observe there's a period where they look really awkward and weird when they're moving. Like I kind of refer to it like seeing Bambi on ice, right? Like, but look really, really funky with their movements. So, regardless of whether they're injury or not, I think there should be some form of resistance training that's conducted where you're touching on all of these kind of basic movement patterns to expose these kids to these moves, to increase the capacity and the capabilities of doing these. So that when they are, if in the event that they suffer from a load-related overuse kind of injury, they already have a base to build on. And then using this base, we can start rehabbing and working on these movements to improve pain, to improve their function, return them back to sport faster. And then they tend to bounce back a lot quicker if they do kind of suffer these overuse kind of injuries. Um, Aside from a like rehab injury prevention perspective, like, all of these movement patterns will also be beneficial to them on the pitch, court, field, whatever sport they're kind of playing in, because they'll be more competent with their movements as well. And it really doesn't need complicated. Like all of these movements, like when we see this, generally, I think we think about like we have to do it in the gym, but it really can be done like on the pitch, on the court, on the field, whatever's convenient, minimal equipment, as long as you're kind of exposing them to these movement patterns.
Do the video.
Yep.
So, oh, sorry, I'm just going to switch the share for 2 seconds and share um, just a video of performing some um, resistance training at home, just using some body weight and some basic equipment. So here you've got a hinge pattern. You got your pull. This would depend on what you're allowed to do within your home. Some pulling exercises, some pushing exercises, more of that squat pattern, and then another push here. I guess what is highlighting is that resistance training doesn't need to be a sort of 90-minute session in a gym 3 or 4 times a week. We can accomplish a lot in a short amount of time, and often with minimal equipment. And I think that that's sort of a key thing with all the interventions that we use, that, something is better than nothing. And often we don't need too much of a stimulus, especially in kids who are likely to be relatively untrained from a resistance training perspective. Even just, a 15 to 20-minute session, a couple of times a week, can be really effective and can help make some gains. When Joe was talking about sort of that balance between capacity and demand, I think strength comes into that. So if you look at that equation, strengthening both the muscles in terms of their ability to tolerate the load that the body's going under when you're playing sport, but also when you're training the muscles, you're also training the tendons, you're also putting a certain amount of load through the bones, and you're just conditioning the whole body as a unit to be better able to tolerate load. So this sort of directly fits into that load management equation. The other thing to note is that with your resistance training, we can use that as part of the rehabilitation program, not only to increase or desensitize the injured area and increase the load tolerance of the injured area, but we also train the rest of the body. So if we've got a part of the body that we can't do anything with, it where dealing with an injury where we're not able to run, then we can sort of work the rest of the body and make some progress. I always think of injury as, there's always some sort of silver lining where if you're not able to participate in your sport, you can still improve other aspects of your physical capacity that are then going to help improve your performance in the sport once you're recovered and once you're able to get back into training and competition. So I think that's really important to recognize as well. All right.
Gary, I've just seen your question in the chat as well. So for everyone who hasn't seen the question, Gary asked, what sort of load would you use with different ages, and at what point would you move them from purely body weight to adding external load? So I think, yeah, there's no real kind of like answer in a way. It's all about like the movement patterns, the capacities, the competency as well. So if someone is like really competent, let's say with the body weight movements for all of these movement patterns that we talked about, the squat, the hinge, split leg, upper body push, pull, etc., then that could be a sign that they're ready to be exposed to some external load. I think a lot of the questions I get when I see clients in the room is, oh, is it safe for my child to lift weights? So I always say to them, there's a lot of literature and research these days saying it is very safe for adolescents and youth to start doing resistance training. And then the kind of like general kind of life example I give is like a lot of kids they're carrying bags around all day, right? And school bags with like books, laptops, whatever it is that they're having. Generally, these bags could weigh, I don't know, 10, 20 kilos, whatever it is. And these kids, if they're carrying all their books, for example, like, and what are your children doing throughout the day? They're putting the bag, they're carrying, picking up the bags, putting them down all day, which could essentially be a squat or a deadlift. They might be slinging them over one arm, one shoulder, which could be like a split upper body, lower body kind of movement pattern. So there's no like if you look at that in terms of like external load, that's already an example that's kind of been exposed from when they're very young. They've developed that kind of capacity, they're still able to do it. So transitioning that kind of logic into the gym is very similar in that sense. So I don't think there is a golden kind of age to like be like this is the right age to start lifting weights. It's if they're competent with doing that movement without any kind of load, then there shouldn't be any reason to then start adding external loads in. Obviously, you're not going to do something crazy and just give them like 100 kilos right away on a squat, for example. But obviously, as you gradually drop the loads like that on ramp in pre-season, there shouldn't be issues in terms of that.
And I think it's important to know. I think some of the concern around resistance training in kids is sort of the bony skeleton and the development of the bones. That's really, there's so much more load that goes through the skeletons when they're running and jumping compared to lifting weights. And so that's really, nothing to be concerned about.
Mm. So, in terms of interventions for the resistance training, I just added a couple different examples here. Like these aren't the be all and end all, like the gold standard kind of things. It's just some examples of what we could do. So, at the beginning, let's say this 14-year-old boy has some sort of competency with lifting. At first, we might start with some box squats in a pain-free range of motion, so we're not triggering his Osgood ladders. We then might supplement that with more of a posterior or like glute, hamstring, calf kind of based exercise and general body strength with some trap bar deadlifts. To be a bit more specific, we might do some knee extension isometrics, so just some holds for the quads, just to help with pain relief and to start rebuilding that low tolerance. We can then do some hip thrusts, and then gradually, as his function improves, we can start adding in and incorporating some graded plyometric or hopping and jumping kind of exposures. And in this phase as well, you can still do some sort of technical drills with him. Like if he's able to stand still, maybe we can do some passing just in the gym, build up the range, the kind of distances, very kind of technical drills that you'd have in your sport. And then we kind of tick that box off. And then, okay, we know he can this, gradually get him back to running. And that would be kind of your markers to then gradually return him back to training. Maybe in a modified capacity to begin with, maybe you can do the warm up, these kind of drills, these kind of movements, take him out of the games, and then gradually kind of like drip them back into that full training and then game minutes as well based on the functional capacity and or pain.
Cool. So we'll go on to diet sleep now. Going back to that load management equation, the what you're eating is part of your capacity. So how you're fueling your body, it comes into that equation. All of us right now, just as we're sitting watching this presentation, our cells body are turning over. So we're getting this continued sort of breakdown and regeneration of cells, and that the rate at which it happens depends on the amount of activity that you're doing. And when the rate of breakdown exceeds the rate of recovery, that's when you start to see some degree of tissue failure, which then lead to injury. But the amount of energy that you're taking in contributes to that. And so if you are undernourished for the amount of activity that you're performing, then your body's capacity to recover is decreased. When I think about the reasons that, and we preface this by saying that youth athletes and young people in general, a lot of the time, even though we have got an obesity epidemic in children, I think those who are physically active, we do see a lot of them who are often performing sports at an energy deficit. When I think about the reasons for this, I tend to like break it into three main categories. The first one is a lack of understanding and recognition about how much extra energy physical activity requires. And also, I guess there's an element of sort of like laziness or even just the logistics that comes into it. But a lot of children and parents for that matter don't actually realize how much more energy the body requires when we're physically active. If we're going from being relatively sedentary to doing, 3 or 4 sessions a week of an hour of relatively vigorous activity, even for a child, that adds an extra, 300 to 500 calories a day of energy requirements. There's also the logistics factor of, if a kid has to get on the bus here at 6:45 to get out to ASIJ, it's understandable that they're going to prioritize staying in bed for an extra 15 minutes than getting up and having breakfast. I heard a statistic the other day. I think 25 to 40% of children, this is at least in the United States, don't have breakfast. So already that's a massive cut to their caloric intake. And then there's those children that don't that are not guided to eat by hunger. I think we've all experienced those times where we're doing more activity and therefore we want to eat more, but that's not always the case. It's not always coupled in that way. So you might be increasing your activity, but you're not getting any hungrier and therefore you're not eating more. So I think education is really important, having a good understanding of what is required in terms of energy requirements, and then having strategies to try to have the child eat to those requirements. Um, this is a little counterintuitive and maybe a little controversial. And, I'm not a dietitian or a nutritionist, but I tend to find that with this population, the quantity is more important than quality and probably an easier thing to address more early on. Um, if, especially with the picky eaters or children that are just naturally not particularly hungry, it's difficult to actually make. We run out. Okay. We're going to go to our normal. Sorry, guys. Mm, Give me 2 seconds so I can change the audio here. Actually, I think that looks fine. Sorry. Might be just a change in audio quality. But if you can't hear us at all, guys, then please drop it in the chat. Um, So, yes, if you're dealing with those picky eaters or children that are not naturally hungry, then they might actually do better with, at least to start with, going for calorie dense and perhaps more processed options until those sort of build in those habits. And then obviously we want to encourage healthy eating habits, and we don't want kids just eating junk food. We're thinking about the importance of fueling our bodies in terms of energy intake to match the requirements. It might be an easier way to do it earlier on. Let me just check here. What's the feedback? Okay. I might actually duck next door. Is that all right? We won't get that feedback. Sorry for the interruption, guys. The second reason is more likely related to aesthetics, and this is particularly relevant for young female athletes, especially teenagers, who may have a focus on trying to achieve a certain degree of leanness. This can be a difficult area to navigate. I think as a parent, trying to observe any significant changes in body mass, and also just having an open line of communication so that you're able to discuss this should it come up, and try to address any issues. And obviously, this is on a spectrum of maybe just wanting to be a little leaner to obviously this can lead to some more serious psychological issues.
So yeah, having a good relationship and the ability to discuss this type of thing openly is really important. As a coach and as a parent as well, like giving young people um, role models, preferably within their sport, people that they look up to, and try to emphasize the positivity around an athletic figure and try and normalize that. Um, and obviously, if it does appear that there is a more serious issue going on, then you might need to look at bringing in additional support in the form of a dietitian or even some psychological support. The third one is weight category sports. This is maybe not necessarily relevant for everyone here. I know there's at least one parent whose child is involved in wrestling. But this is often a combat sports thing where it's more important that the children are matched more evenly in terms of size. Um, but it can be relevant for other sports as well. I know from my personal experience, my son, we applied for a tournament. I think the application was in January for a tournament in April, which is part of being in Japan and everything needs to be done way out in advance. And at the time, he was 29 kilos, and we applied for a 32 kilo division. And this tournament is in a little over 3 weeks' time. And right now he's actually getting close to that weight limit, and we're having to sort of navigate this situation as what do we do? Do we get him to weight cut? It is a tricky one. Um, I think it's even harder if you're in a sport like with wrestling, where it's an individual sport, but you're competing as a team, and so you need to fill certain spots within that team. And if you have a team in which you have several competitors at the same weight vying for the same spot, then and you're maybe presenting it as if Johnny's our number 120 pounder. So if you want to compete, then you need to drop down to 115. That can become really difficult. So uh, as as a parent, trying to presented like trying to I guess always try to go up a division and have the child compete at a higher weight division if possible. And as a coach, you might need to it might not be optimal for the performance of the team, but offering the chance for two athletes to compete in the same sort of division and alternate between meets if that is an option. In terms of sleep, sleep is another crucial aspect of our recovery and repair of our body. Not only the tissues of our body, but also that psychological repair. Um, this can be difficult. And I think it's even more difficult these days with a lot of children having regular access to phones and tablets and other devices from an earlier age, and the influence of social media and the social connection that often happens during the devices outside on the devices outside of school time. Um, I think trying to educate children about the importance of sleep, I think it's not, even compared to nutrition, I think it's less appreciated by kids as a crucial element of their performance. So as a coach, educating kids around sleep, if you're part of this team, we're working hard together, but we also need to rest hard together. Maybe if it's possible, trying to implement rules around, everyone turns off their phone at 9 p.m. or whatever it is, to try to get a bit of buy-in and trying to create those habits. All the same sort of sleep hygiene things that us as adults, I'm assuming, have sort of drummed into us in terms of limiting device usage, trying to have consistent bed times and wake times every day if possible, using things like baths and showers just prior to going to bed can be useful. I think having a strict schedule whereby homework is prioritized. Obviously, if we're practicing after school, then that's going to sort of push that timeline back. but prioritizing homework, completion of homework before going on to other activities, whether it's gaming or use of devices and engaging in social media, so that we're not having to then delay starting homework later in the night, and then that causing us to miss out on sleep. We could do a whole session on sleep, but it is super important, and everyone's going to have their different ways of managing that. But as always, it sort of comes back to communication between coach and an athlete and parent and child, and just trying to emphasize the importance of that for performance. Joe.
Yeah, so just to kind of reiterate what Sam said, I think what's important to remember is health, injury, and well-being it's all interrelated. So with three kind of big
Big
rocks,
rocks.
your biological side, your psychological component, and the social component as well. So again, like what Sam said, I think the relationships between the coaches and the athletes, the parents and the athletes, as well as the coaches and the parents, become really important. Because there's a lot of people kind of involved in like, this athlete's kind of development athletically and socially and personally. And I think what's really, really important in this regard is that the same language is used and the consistent kind of language and messages is used that the athlete can listen to and is receiving. So, for example, like with modifiable and unmodifiable factors, like we can't really change how someone develops at how fast they develop. We can't change like what their kind of genetic potential is, but we can kind of change how they perceive messages. So if like language is, let's say, very pressuring in some cases or very aggressive, that individual might not react very well, whereas another individual might be more receptive to that kind of language. So it's really important, I think, to identify who the person is in front of you, how they kind of best respond, and make sure the language is consistent. And this is where I think that relationship, and in Sam's words, an open relationship, or between all parties, becomes really, really important because we don't want the child to feel excessively pressured either. In terms of the language as well, I think it's really important that if they are injured and they're kind of like in a phase where they think they might not want to continue playing this sport, which I myself went through growing up playing soccer, then transitioning to lots of different other sports. I think it's important to let them know that it's okay that they don't necessarily need to compete at a certain level, and they shouldn't feel pressured to, and they should feel free to try other sports as well, and which is actually going to benefit them in the long run anyway. There's a lot of stuff these days about multi-sport exposure, which will benefit the athleticism. So, for example, I think a very practical example, there's a few soccer, football kind of coaches here in the chat today, and our example is kind of focused on football, soccer. So one of the things I think is really, really good about soccer is it's a sport that is kind of very similar to like basketball or even netball, for example. But the difference is like your soccer being predominantly more of a lower limb sport. Basketball and netball are more upper limb, but they're still running, they're still about scoring. Tactically, the concepts are very similar. So you can like have different kind of exposures to sport in this way, where they might get a little break from soccer or football. They can have a bit more fun playing a sport where, maybe it's not about like who's better than who or what the pressure is, what the standards are, things like that. And then we can kind of just like work more on the tactical elements of the sport as well. So you're not really losing out in terms of athletic development or tactical development. You still can have a coaching um, improvement in that sense too. And in that way, I think language, like I kind of touched on before, making language more performance based, especially when it comes to like resistance training, becomes really important. I think a lot of youths and adolescents might not see the benefits in like going to the gym when they're already training X amount of times per week. They might feel they're tired, they've got things to do. So shaping it in a way where it's going to be more beneficial for them to perform in their sport, I think becomes a lot more important. Okay. Okay, and then touching on basic principles of rehab, I think growing up we all heard of like RICE or RICER, rest, ice, compression, elevate. Now that's kind of a bit more evolved. It's more evolved into what we now use the acronym peace and love. So you can read, I won't go through every single thing here, but essentially we want to protect it, still compress and elevate and educate, but the most important thing is kind of loading the injured site as we can, as we can tolerate. So this is where like our resistance training can kind of come into effect in terms of rehab. So we might want to address pain first, then start restoring the range of motion, then restore strength, but also not only restore it to where it was, but develop strength and also develop strength in other areas, like Sam mentioned before. We can also use this opportunity to work on different functional movements, eventually return to running, work on cardio, cross training, and multi-sport exposure, like I touched on. So the cross training and cardio aspect is really interesting. So, for example, with our Osgood Schlatters example, like if they're not able to run, then maybe we can get them on the bike to work on their cardiovascular health in their system, or we can even get them swimming in the pool, things that might not aggravate the knee as much. And then, yeah, so in terms of the intervention, so in terms of cross training, like I said, we can go bike, swim, rower, and we can start looking at maybe a graded return to running, whether that's in potentially starting with straight line, then curved linear runs, then building volume, building speed, for example. From there, after we worked on some technical drills as well, you can start gradually returning them to training, maybe some stationary drills, and then controlling it in a way where we talk about control versus chaos. So it's a bit of a continuum. So like, let's say if it's football, just a standing passing drill, 5 meters is really simple. Different types of passing. We might then increase the distance. Then they might need to have some lateral sideways movements or curve movements, or they might need to react. So this starts to become a bit more chaotic, and then a bit more free drills where like players have to be more free flowing before going to more like match game sim or match simulation type drills as well. And then once they kind of tick those off, you can start thinking about returning to matches. Might start with like limiting the certain amount of minutes they can play based on their capacity. Because again, even in this phase, the thing we want to avoid the most is having that load that's applied exceeding the capacity, so that we can keep gradually building it up. So that might be like starting with 15 minutes, 20 minutes a game, to then half an hour, to then one half, three-quarters of a match, and then a full match, for example.
Cool. So, just going to go through, making sure that you can still hear me. Yeah. So Joe mentioned a few conditions, and we've sort of focused a lot on this traction apophysitis here. I think it's important that these conditions, and any condition really, is diagnosed and managed correctly. Um, Even though these traction apophysitis are quite common in kids, we can still have kids that have an Achilles tendon issue and a patella tendon issue, and it's important to diagnose or have these injuries assessed in relation to their stage of growth. So if someone comes in, we can have a look at, the height of the mother, the height of the father, the current weight of the child and their age, and have a rough idea how tall they're going to end up. And then that comes into play when we look at periods of peak height velocity. So typically we see the growth spurt occur around that sort of 92 to 93%, and spanning out sort of from 88 to 95% of your peak height is when you have that sort of that bigger growth spurt, and then it really reaches that peak velocity around 92 to 93. If someone comes in and they're sort of taller than their father already, and they've sort of stopped growing, and then they're complaining of knee and knee pain or heel pain, we're probably looking at other diagnoses, because in all likelihood the bone, the growth plates that Joe was referring to, have fused at that point, and so then we're looking at some other diagnoses. Um, and in terms of the management of these, it is important that they are managed correctly, and correctly is difficult because they are difficult to manage, and it's possible that a child may be dealing with this type of issue for a long period of time, because it does take a long time for those growth plates to fuse. And so If a child just tries to push through the pain, then the pain can get quite significant with these. And as we talked about before, they might then sort of lose the motivation to continue being active and they might sort of give up on sport altogether. So there's a lot of strategies. Sometimes it is difficult to work through, but there are some strategies that we can implement, as Joe sort of outlined in that case study, to keep them active and keep them playing sport. Um, the lumbar bone stress injury, this is probably the most important one to have diagnosed and managed correctly. Um, when a child has back pain for any period of time, more than a couple of weeks, that's not really normal. So it's quite common for an adult to have a grumbly lower back for several weeks associated with a disc, a joint, a muscle, whatever it is. But that doesn't really happen in kids. And so when kids have ongoing lower back pain, we become very suspicious of that lumbar bony stress injury. Um, and it's important to have that diagnosed because if it continues and if we continue doing the activity that flared it up, then there's a likelihood that the bone will stop trying to heal. In the early stage of this bony stress, you're dealing with a metabolically active area where the body is trying to mend that gap in the bone. And if you catch it at that point, we actually manage these injuries quite conservatively. So we might use bracing to restrict the amount of back bending that child is going through. We can still train that person quite hard. So we can do resistance training in positions that don't aggravate it, but we really limit the amount of sort of back bending that's going on. And then as they start to improve symptomatically and we get radiographical evidence of healing, then we can sort of gradually progress them back into extension-based tasks. The type of sports that we see this a lot in cricket, fast bowling is the key one. Gymnastics, obviously a lot of sort of back bending that goes on there. We see it also in jumping sports, basketball, volleyball, where you're jumping, with the arms up overhead, so you're already in that sort of extended position. And to a lesser degree, but certainly not uncommon, we do see it in field sports, our soccer and football and hockey and things like that. Um, if we are too late and the body has stopped trying to repair that area, then we get left with that fracture, which then fills in with a sort of cartilaginous type substance. So it sort of becomes a little bit more like a joint. Now, that doesn't mean that person is going to be walking around with like a broken back or an unstable spine for the rest of their lives, but it does increase the likelihood of ongoing lower back pain, which may limit their eventual performance in sport. And especially if we're dealing with kids who are playing sport at a high level, if they go on with a defect in their lower back, then that may limit their performance in sport. We're generally against imaging for routine sort of imaging for lower back pain. So if someone comes in with an adult comes in with a niggly lower back and they don't have any spine, any neural symptoms, any sort of numbness or weakness in the legs or tingling or anything like that, and it's just lower back pain, then we don't really want to image that person. The image is, if we get an MRI, it's likely to show some disc changes and things like that are probably not relevant to that person's pain. However, in a child with ongoing lower back pain, we need to image and we need to have both an MRI and a CT. An X-ray, even though it's a bony condition, is not actually going to show the information that we need. These conditions are usually too early on to be detected on an X-ray. So we actually need an MRI to show the line of the fracture in the bone, and then we need the CT to show the degree of metabolic activity to see if this is an injury that we can salvage. So again, if you do have any of your athletes or kids with lower back pain that's persisting for a few weeks, and especially if you're in those high risk sports, do get them assessed, as that accurate management is vital. Chronic regional pain syndrome, like Joe alluded to, as when basically the nervous system is overreacting in a big way to what's going on in the body. Now, in adults, this tends to take a very, very long time to treat. So people may be dealing with sort of problem for months, even years. Um, in children, we see a very different presentation. It's still termed chronic regional pain syndrome, but the way it comes on is often very different. So they'll have an acute injury. We often see this with ankle sprains. Um, what is seen, and you may take the child to see a doctor. They may X-ray to rule out a bony injury, or due to the minor nature of the injury, they might might not feel that that's necessary. And so you manage this as a minor ankle sprain, but all of a sudden it gets very painful, and these can get to the point where the child is unable to actually put any weight on the foot. And this can escalate very quickly into a very painful and very, very limiting condition. Now, the good news is when managed well, they can respond almost as quickly. So this is generally not something that we're working with people for months and years. We have assessments that we perform, and often, the child will be very, very sensitive to touch. They might even have some discoloration in the area. And we, rather than treating it as a mechanical ankle sprain, working on gradual, range of motion work, strengthening, things like that, we take more of a graded exposure approach. So we might even be just gently touching the foot with a tissue or a very light implement to get them used to that sensation, because often it's very, very, very tender to touch. Gradually exposing them to pressure to the area, and then gradually working on their weight bearing. So having them maybe step on a scale with just like a kilo of weight to start off with, just getting them used to getting a little bit of weight on the limb, and then gradually increasing the weight that they're taking. Now, this may sort of resolve over a few weeks. It may take a little longer. However, we do see some children that will come in to see us. They may have had an ankle sprain for a week or two that's gotten really bad. We see them on the Tuesday. We do our assessments. We do a little bit of, we take the parent through how to apply direct pressure and also loading in a very gradual fashion. And then we see them on Friday, and then they just sprint into the clinic and they're a completely different person. Sometimes just a bit of education, reassurance, and just initiating that graded exposure to load can sort of just flick that switch in the central nervous system and decrease that guarding and reduce the pain. With all of these things, accurate assessment and diagnosis is key. The other one that we had on the list was concussion. Now, I know some of you joined in our previous webinar that we did last year on concussion, and if you're interested, I can send you the link. So please email me, and I'll send the recording of this to everyone who signed up here, and I'll also include the concussion webinar from last year. But this is really important. There's been a lot more attention placed on concussion in sports and youth sports included. And we know now that the long-term outcomes of concussion in sport can be quite serious. So if you do have a child who, and this doesn't necessarily need to be a result of a head injury. It may be a tackle in soccer or football that didn't actually involve direct trauma to the head. And it doesn't need to be associated with loss of consciousness either. But if you have an athlete that obviously impaired consciousness, but things like reduced balance and coordination, delayed reaction time, vacant stare, slurred speech, dizziness, disorientation, visual disturbance, obviously things like convulsions and seizures are quite a serious symptom. And then sort of delayed symptoms such as headache, emotional changes such as irritability, lethargy and fatigue, ringing in the ears, sensitivity to light or noise, sleep disturbances, coordination issues with running and walking, nausea and vomiting, difficulty with concentration, or just a change in their performance on the field can be signs of concussion. And most concussions do resolve within a few weeks, but if someone has sustained a concussion, then they're unfit to play until they've been cleared by the doctor. Red flags with concussion. headache that sort of starts worsening from the onset of concussion after the incident. Um, Episodes, two or more episodes of vomiting is quite a severe red flag. Seizures, double loss of consciousness, any sort of change in pupil size or asymmetry in pupil size, any complaints of weakness or numbness in the limbs, and slurred speech. Speaking slurred speech. I haven't got a concussion. Just a bit tired from a long work day, and worsening sort of confusion are signs that if these signs are coming up after a suspected concussion, this is more of a medical emergency. Um, that's sort of the end of the structured content that we had. Joe, was there anything else that you wanted to touch on before we get to the questions?
No, I think I'm fine. I think we can head to the questions.
Yeah. Jonathan, you dropped a question in the chat. Strategies for assessing when minor injuries need further attention or rest, especially with middle schoolers who may not want to talk about it, having the right language to describe it, or know when something needs a further checkup. It's a great question. I guess one thing that we didn't mention is that, as physios, we are doing everything that we can to keep a child involved in sport. And we've alluded to some of the more serious things, such as bony stress injuries in the lumbar spine and concussions that really do need removal from sport. But for the most part, we're really trying to keep the kid as active as possible. So that might involve, like Joe talked about, altering playing minutes, or a very brief, 1 to 2 weeks of removal from sport. But where both Joe and I and the other physios on our team and everyone we deal with, we're all either current or former, and sometimes former, pretending they're still current athletes. And we know how important it is to be out there, to be competitive, and we know how important it is for the kid to, for all the physiological, psychological, emotional, and social reasons to continue playing. So we really frame it as modification of things to optimize the performance long term. And we will only take a kid out of sport if we think it is really necessary. Um, when a minor injury needs to get checked out, I guess if it persists more than what we would interpret as a normal time frame, and that's going to be different from every injury. But if you've got an idea of why an injury came on, so if you had an acute injury that an acute onset, either a tackle or a sprain, and you have that cleared, or maybe you don't. Ideally, like I said, most injuries that occur acutely should be screened, should be assessed properly. Um, or if you have a gradual onset injury and from a load perspective why that has occurred, and you can sort of manage that load, and the injury, starts to resolve, then, you can maybe approach it with the confidence that it should continue to improve. I guess when things don't start to improve, then having that conversation with the athlete and just talk about your understanding of how important the sport is to them and how their success and and their performance coming at it from their side, not how important their performance is from you as a coach, but how their performance is important to them. That you want them performing to the best of their ability when it matters. And this is easier when maybe at the start of the season, the more important games haven't come up yet. You've still got time to recover, get you back as strong as possible, and get you back in time for the more important parts of the season. Sometimes, if you are dealing with something and maybe it is an important point in the season, and you're coming up to final games or whatever it is, and we need that athlete to continue playing, it's also important to get it checked out, because more often than not, we'll understand that situation. And whilst it might not be ideal in the long term to continue playing, to get you through this situation, there are things that we can do in terms of modification of training minutes leading up to a game. There's taping, there's self-management strategies, there's manual therapy things that we can do to get that player across the line. So I guess coming at it as, we need to get it checked out, but doing so is going to improve your performance when it really matters. That's how I would sort of frame it. Joe, any other ideas regarding that one?
I think all of that is really, really good. I think, yeah, I think it's really comes down to the context of things too, like timing, like Sam said, if it's big games or if there's not, like, I think it comes down to, I think, internal and kind of external beliefs and values. Like if, let's say there is a big game, the child wants to play, then I think that's a big reason to kind of get them to get it checked out. For one, peace of mind, safety, how much are they able to be involved in, things like that. I think it really comes down to trying to figure out what is important to the athlete and how, like, what do they see as, I guess, their goals immediately, but also short term, middle term, long term goals regarding their body and their athletic development in
Mm,
terms of trying to find strategies and how to better communicate, I guess.
yeah, yeah, really good point. Um, does that sort of answer your question, Jonathan? Yeah. Gary asked, any advice for coaches who only see the athletes a few times per week, every other day maybe, and aren't involved in all their other activities, PE lessons, other clubs, etc. Yeah, that's a really tricky one. I would maybe, if you have an intake form where you can get the athletes' details prior to the start of the season and just sort of asking them. Um, what other sports they're playing and how much of those sports. And if you can sort of coordinate with the school in terms of the PE and if there is a PE curriculum, um, trying to get hold of that, having an idea roughly of what they're doing in terms of sports. Like I know when I was growing up, PE was kind of random. Like, we would be doing a sport for maybe one or two lessons, and then the PE teacher was having a really bad day and would make us do like a 5K run to fill up the 40-minute block and actually absolutely torch us. Yeah, like to think that that sort of thing isn't happening, but like it may well be. Um, I would, yeah, just either try to get the details from the PE teachers about what they're planning on doing throughout the semester, or just having a rough idea, like just in terms of the overall volume of PE and just assuming that that is going to be involving a certain amount of running and then sort of factoring that in with how you're programming the training for your athletes. Any other ideas, Joe?
Yeah, I think that's a really good point. I think trying to understand what their schedule is one thing. Like obviously every person's going to have a different kind of schedule, but let's say I think the biggest problem that I ran into was when athletes would have like double or even triple sessions in a day. That's where, like, as a coach, like, I guess in terms of your job responsibility as well, it's like you don't really want to be, it'd almost be better for them to do a recovery session rather than participating in a planned, structured session, which could put them at greater risk if they are backing up sessions after sessions after sessions, especially over consecutive days as well. That's where the load really ends up spiking like a crazy, crazy amount. Um, so it becomes really frustrating. I think working with this age group is one of the most difficult because everyone's kind of everywhere doing lots of different things. But yeah, I think the best thing to do is kind of like what Sam said, try to understand what they're doing. Sometimes things are random, sometimes things aren't. And if you do need to kind of alter your plans, even your session plans, that might be what just needs to be done at that on that certain day, unfortunately.
Hmm.
Yeah.
Yeah, and obviously just having a good communication with the athletes themselves,
Mm.
and just being able to talk about that, and obviously if you've got a team of a group of 30, 40 athletes, that can be very difficult. But yeah, if you've got a smaller team, just having that 1 or 2 minutes of chit chat with each of the athletes and asking them about what else is going on in their life athletically, yeah, can be good as well.
Mhm. Cool. Thank you.
Cheers. Next question is from Makoto. My challenge as the athletic director at a small school in Tokyo. The season changes every 11 weeks. The games competitions are scheduled on the third week of the season. There's not much preparation phases for our athletes and coaches to slow down to take care of fundamentals, fitness, and recovery. Do you have any advice on how to go about it? I think my coaches agree to help our athletes become successful and healthy down the line. Um, so I guess does that mean you're changing the sports that I'm going to assume that that's what you mean is that you're changing the sports that are being played every 11 weeks and you're starting the games on the third week of the season.
Yes, that's right. Yeah.
Yeah. Mm.
Yes, that's right. Yes, it's my.
Yeah, thanks for that, Makoto. So I guess trying to communicate with the other coaches. So I guess you as the athletic director have the
Yes.
ability to communicate with the coaches so that if kids are going from one sport to the other, the previous, I guess the coach of the sport that the kid is going into will then have an understanding of the volume and demands of the sport, the previous sport, and it sort of depends on the sport. So if you're going from a running based sport to a another running based sport, there may be a bit of a difference in terms of how much you're running, how much high velocity running is going on there. Um, but you're going to be okay in terms of managing the overall workload. If you're going from a running sport to a jumping sport, then it might be worth coordinating with that previous sports coach and if they know the players that are then going on to, say, a basketball season after a soccer season, getting them to do a small number of jumps as part of their practice. All right, just as something different for the warm up today, we're going to be doing some jumping. And it's not something that's necessarily going to hinder the other kids in the team who might not be playing basketball. Jumping is a good warm up and is a good sort of explosive power drill for the kids to do anyway. That's kind of just a specific one example of how you might be able to manage that. Um, yeah, Joe, any other ideas on that one?
I think it's a very difficult situation. The the way I think I would approach it is because all the sports, I guess, different and changes every 11 weeks. Then I think it'd be a good idea to kind of everyone sit down, kind of look at the calendar, see what sports are what, and then kind of plan, I guess, from a supplementary resistance training perspective, like you can really try to target that in the different phases of the year. Like let's say they're gonna do whatever sport it is, maybe it's easier to do lot more or more beneficial to do lower body training at this point in time, upper body at this point in time, so they're not overloading and kind of like doubling up on kind of supplementary resistance training and youth athletic development as well. Um, and then yeah, what Sam said as well in terms of the exposure to plyometrics, jumping, landings, that sort of stuff too. But yeah, I'd say this is a very difficult kind of situation to manage. But that would kind of be the way I'd approach it from a more athletic development perspective. So then we can try to mitigate kind of injury risk in that regard.
Yeah, and I think also sitting down with all the coaches if you can and coming up with some similar and consistent advice and guidelines so that the kids aren't getting too many sort of mixed messages in terms of
Mm.
recovery and diet and sleep and resistance training. And so if a kid goes from saying, Coach Makoto when I was playing soccer, he, after every training session, he said, make sure you're eating enough, make sure you're getting your breakfast, you know, pour out your cereal and whatever the night before so that you can get up, slam that down before you get on the bus. He was also talking about, turn off your phones at 9 o'clock, making sure you're getting to bed. And then he gave us this basic resistance training program with a few squats and some push-ups and things that we could do at home. And then I went and started my basketball season with Coach Gary, and then Coach Gary was saying the same thing about food and sleep, resistance training program. And so, and then even creating some resources, so that you're pooling your efforts so you don't feel like you're on your own. It's like, oh, I've got to write a program for the kids, and then I've got to send them something about food and things like that. We're happy to even help with some of this stuff. Putting together some resources. You have like a handout on eating habits, the importance of sleep. You may have a few basic exercises, and here's how to progress, here's how to regress, and every coach has the access to that. And it might be, and then you might have your core things that are there. You might have stuff that's a bit more jump specific for your jumping sports. You might have some upper limb stuff for more of your throwing sports. But that way, the coaches can work together to develop a set of resources, and have maybe different delivery methods. Some people are better sort of reading things, others would want a video. And you can, yeah, like I said, pool your efforts, pool your resources together, so that we're being more time effective with that, and we're sending consistent messages. Interested to hear from other coaches. So this question's from Gary. So Gary and Makoto work together. I'd be interested to see if there are any other coaches from international schools, how much time they put on developing physical attributes, and how much time they spend on skill development. Our middle school teams train twice a week for an hour, and then maybe one game, sometimes in place of practice, sometimes additional. High school is 3 times a week for 1 hour. How do other international school coaches balance their sessions? I'd be interested to hear that as well. I know from my experience working with other schools that the high school level, sometimes that can be sort of 5 days a week, plus games. I know some take it very seriously. I'd say on average, probably 3 to 4 days training a week, plus games on the weekend. But if any of the other international school coaches, or even parents, want to jump in, feel free to do so. If not, are there any other questions that people might have? I guess, yeah, the final message, the load management and load is really the crux of what we do. And oh, sorry, Alex. Perhaps Makoto could answer this. When athletic directors meet, are these factors taken into account when planning sports season schedules? Yeah, interesting. So the international school year is a short one. So on one hand, it's great that they can play 3 sports in one academic year, but it probably runs counter to this session that my team had to go straight into a 2-day tournament, some girls having to play 260 minutes without practice games and a few training sessions. Yeah, that's really tricky. I guess Makoto or Gary, if you are able to answer that, it'd be interesting to hear how that's planned.
Yeah, hello. Can you hear me?
Yes.
Oh, good, great, great. Hi, hello, hi, good evening. I'm Makoto. Thank you for all this. And then, sorry, I came in late because my dog was bothering me. So, but he's calm now, so I can talk a little bit.
Great.
Yes. I This is my 4th year doing this job, and then before taking this job, I was helping supporting more high performance athletes for 7, 8 years. And before that, I was the athletic director at the international school. But this school, I feel kids are over compete, under train. They as soon as the season starts, coaches have to rush and prepare in a couple of sessions, and then they go off to the game, and then all right, and then fix it in a couple of practice, and again go off again to game, play game, and repeat that. And kids grow, the kids do improve, and the kids enjoy. That's great things, but I always feel that we are all under always have to kind of band-aid the situation rather than looking at the long-term solution. But all coaches, I think, agree all of athletes to become successful down the line in the long run. So we don't really worry about today's winning. However, we worry about today's kind of band-aiding the situation to just get by for this weekend's tournament, that type of things. And we do that for 11 weeks. And as soon as the basketball season is over, now different sports starts. And then, soccer coach probably do similar things, that type of things.
And
So that's a struggle. Yeah.
Yeah.
And I know from speaking to Makoto as well, and I know from the schedules that we have and looking at all the calendars that it is a short 10, 11 week season. Often bang in the middle of that, there is a holiday. So it's 3 seasons. There's a fall season, a winter season, and a spring season. And each of those seasons have a holiday in the middle, which takes out a week. There's often residential trips for the schools, various schools, and they often don't align. So I know, and then within like the league system, I'm quite fortunate in some cases that I coach cross country and track and field. So it's big competitions on the weekend where everyone's involved at the same time. But for sports like basketball, soccer, volleyball, you're having to arrange individual matches with 10 other schools and trying to fit in around both our calendar and their calendar and other games that they've got arranged against other schools and things like that. So it really is just a case of trying to get the games in somewhere. And then, yeah, like Makoto says, we try as much as possible to focus just on the overall athletic development and the kids' enjoyment, and hopefully success will come down the line at some point. But yeah, it really is a big logistical nightmare. I certainly don't envy Makoto his job.
Yeah. I mean, it's difficult when you're having to do it within your school, but obviously the competitions are dictated by the leagues in which each individual school is involved in. So yeah, I can see how that is a very tricky thing, and probably something that's not really possible to change. So you've just got to try and employ those strategies and minimize the negative factors associated with that. Cool. Any other questions? Well, I'll do a 10-second. Often I'll count down from 10 and then people will jump in at 2. So I'll do 10, 9, 8, 7, 6, 5, 4, 3, 2.
I just had to ask. No, I'm joking, don't
worry. All right. Well, thank you, everyone, for joining in today, and thank you for those who did post questions and was opened up some really interesting discussion. As I said, we're always trying to help not only optimize the performance and get kids back playing as soon as possible, but really try to cultivate a love of sport and a love of physical activity, which will hopefully continue on into adulthood for kids. So if you do have any questions, please feel free to email me. And obviously, if you or your athletes or your children are dealing with any injuries, it always pays to get it checked out sooner rather than later. And like I said, if we do end up pulling a child from or recommending, obviously we don't have the authority to actually take a child out of sport. But if we're recommending that, it is really because it's in the student's best interest. So we're not going to take a child out of sport for any reason. So yeah, thank you very much for your participation, and we'll plan on doing more of these in the future, and we'll keep you updated on that. Thanks for Joe, and thanks everyone for joining in.
Thank you both very much. That was really good, really worthwhile. Thank you.
Thank you very much. Thank you. Good night.
Cheers, guys. Thank you.